Hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. Today I have a special guest with me to talk about the Public Health Week. I would like to introduce Dr. Elie Helou.
Thank you, Keith. So it's a pleasure to be here today during Public Health Week. My name is Dr. Helou, like you said, and I've been with StayWell since 2017. I do infectious diseases and primary care.
Thank you, Dr. Helou. Now let's talk briefly about Public Health Week and why it's so important to our health.
Well, Keith, Public Health Week is designed to create awareness about the health within our communities and understanding that where we live can impact our health. For example, the COVID-19 pandemic, it has shown us that one person's health can directly impact the whole community, and it's also shown us that there are inequities within our healthcare
Right.
system. This year's campaign aims to call attention to and help educate communities about their most vulnerable populations.
Isn't that the truth? As a healthcare center, we see patients from all different backgrounds. What kind of barriers prevent people from accessing public health resources?
So that's a great question. There are barriers that prevent people from getting care. There's different kinds of barriers. There's, physical barriers, transportation, mental health issues, substance use, financial barriers for people who have no insurance or are undocumented, cultural barriers, language barriers. We have a lot of Spanish-speaking patients, patients who speak Albanian or Portuguese or other languages, and StayWell can facilitate and help kind of break down these barriers.
Now, I know that we have resources here at StayWell to help people get the care that they need and break through some of those barriers that they may have. So, can you tell us a little bit more about that, how we help them?
Of course. StayWell does offer a range of services to help break down those barriers and gain access to care. Financially, we offer a sliding fee for those who struggle making ends meet, and we provide interpreters, translators for people who speak different languages. We also have outreach specialists who assist people in finding insurance options based on their needs and income. The outreach team can also point them in the direction of savings programs, other assistance programs as well.
That's cool, yes. So, speaking of barriers, that leads me to my next question. We've talked about this before, and I want to know what you have to say about the challenge that the Black community and the LGBTQ community has.
That's a very important question. So in order for people to understand that having support and feeling included in our social communities has a positive effect on our mental and physical health. So people need to be included in their health, and they need to see that the clinician or the provider understands what they're going through and looks like them, speaks their language.
Exactly.
So for me, I try to speak different languages. So I'm fluent in Spanish, in English. So I try to not bring my computer in the room, try to look at the patient in the eyes, try to maybe dress down to be able to look like the patient so they can gain trust in me and they can tell me about their problems and the issues and what's preventing them from seeking care or from taking their medications. Especially during the pandemic, we've noticed a lot of minority populations be doubtful about getting the vaccine, about getting care, about going out there. So it was very important for them to be included in the decision making. So I think that's an important public health point.
Yes, I agree. I do definitely agree because we did this segment last time about trusting in our doctors and making sure that you go to some place that you know that you're being taken care of and you're comfortable as well. So is there anything else you'd like to share with us?
Of course. So public health should be every day. I know that Public Health Week is coming up, but we talk about public health every single day with our patients.
Yes, we do.
So don't be afraid to reach out to the providers and the support staff at StayWell. If you have any questions about insurance, about PrEP, about getting tested for HIV, for hepatitis, for STDs, we have multilingual professional people who work here and they're very open and unbiased and they want to help you. So please feel free to reach out and we'll be happy to help.
Yes, yes, yes. Dr. Helou, I want to thank you for joining me today to discuss public health and how it affects our community. This is an important topic, and we need to bring awareness to.
So if you're interested in learning more about Public Health Week, visit the StayWell blog, where we're discussing health in our community, the 2022 daily health themes.
You can also check out www.nphw.org, shown on the bottom of the screen, to learn more. Join us again in 2 weeks as we talk about the upcoming Give Local campaign, hosted by the Connecticut Community Foundation. Until then, stay well.